Starting from PhilHealth's institutionalization, more and more of the country's population rely on PhilHealth for their hospitalization needs. A monumental task that we, at PhilHealth, take seriously to help us ensure a healthier citizenry. Through our joint efforts with other agencies, sectors, families belonging to the poorest of the poor of the population are able to access hospitalization and outpatient benefits through this program. The healthcare needs of overseas Filipino workers are now managed through the Overseas Filipinos program. Active and eligible OFW members confined abroad are entitled to hospitalization benefits that they can avail themselves of in times of medical contingencies. Their families are similarly entitled to these benefits, a privilege that truly brings peace of mind to our modern-day heroes. We continue to uphold equity among Filipinos through an equalization of benefits for all. We are expanding our benefit packages to extend them to all our members. Over 100 local health insurance offices have been established nationwide, along with more than 60 PhilHealth Express outlets and 17 regional offices and 5 branches to ensure that we can better serve our members. By voluntarily contributing to the program at a very minimal premium, they enjoy the same medical care services that their formally employed counterparts are entitled to. From the outpatient benefit package, which became the primary care benefit, the Tamang Serbisyo para sa Kalusugan ng Pamilya is now available for our indigent, OFW, and DepEd personnel members. Today, we are continuing our initiatives to better serve our members through the establishment of our local health insurance offices and the institutionalization of the PhilHealth Action Center for call and email inquiries. Even prior to 2002, we have always provided benefits for the elderly sector in recognition of their importance to our society. But to further strengthen their coverage, we formalized the non-paying program, which was later renamed to the Lifetime Member Program, as an assurance that their healthcare needs are attended to. Salient provisions of the law are being implemented in view of the fast pace by which medical technology evolves. This is to allow room for future enhancements in our core business processes to stay in step with our clients' needs. In support of the United Nations Millennium Development Goals and as a way of giving back to our members, we are constantly improving our benefits by expanding the coverage, increasing the benefit packages, and adding more of these benefits. We implemented the phase rate provider payment method, wherein all services are included in a fixed rate package to provide equitable, efficient, and effective services to our members. This is also a move to proficiently execute the no-balance billing and empower the less fortunate in our society. As a government-owned and controlled corporation, we take part in the government's battle against poverty and its negative effects in our society through our constant effort in supporting programs that can help alleviate these problems. We continue to empower our members by strengthening our services dedicated in improving our communication with our members and stakeholders. We believe that all Filipinos must be made aware of their PhilHealth benefits and how these can be availed of. In the race towards universal healthcare, special events and activities are being held to show our commitment to ensure a coordinated and intensified effort toward our end goal of bawat Pilipino miyembro protektado, kalusugan natin sigurado. National Insurance Act of 2013 has new provisions that will strengthen and increase transparency and improve quality of service and information dissemination to help us cope with the growing needs of our members. Our complete shift from provider payment mechanism to case-based payments is part of our long-standing promise to provide equitable, efficient, and effective services to our members. We collaborate with other agencies and sectors in initiating programs designed to bring basic healthcare services to intended recipients, especially the poor. It is our mandate to prioritize and accelerate the provision of health services to all Filipinos, especially to those who cannot afford such services. Thus, through the point-of-care enrollment program, all poor in dire need of quality health services in government hospitals who are not enrolled in PhilHealth will be covered. From 5.2 million NHTS identified poor households to 14.7 million families, we continue to widen our reach among the less fortunate and enabling them to gain access to financial risk protection. Hence, committing to our goal of declaring universal coverage for the poor. After 20 years of service and countless breakthroughs on the field, we are proud to say that we offer the most comprehensive health insurance program in the country and is considered as one of today's more active and robust government corporations.